Is IBS interfering with the way you want to live your life? In this video, I will give you 16 tips to help control your IBS better so that you can live your life the way you want to. Hi, I am Dr. I. Welcome to a healthy dose. Let's become healthier together. Tip number 1. Remove stress to find relief. Keep a log of topics that stress you out and stay away from those topics. Tip number 2. Better sleep equals less pain. If your abdominal pain is affecting your sleep, you might want to improve your sleep hygiene. This may include lifestyle changes such as having a regular relaxation period before getting into bed, keeping a consistent wake-up time, using the bed only for sleep, and avoiding caffeine for at least 4 hours before bed. Improving your sleep can benefit your ability to cope with pain. Tip number 3. Breakfast is important to help bowel movements. If you suffer from constipation, be sure to have breakfast. This is the meal that is most likely going to stimulate the colon and give you a bowel movement. Tip number 4. Probiotics and IBS. Probiotics work by adding helpful bacteria back into the gut in an attempt to replace harmful gut bacteria. Tip number 5. Certain medications can worsen pain. In some individuals, the use of opioid medication like morphine can cause pain. They should not be used for pain in IBS. Tip number 6. Keep things moving. Regular exercise improves bowel functions, including the common IBS symptom of bloating. Tip number 7. Pregnancy. If you are experiencing excessive abdominal discomfort during your pregnancy, try reducing gas-producing foods such as beans, cabbage, legumes, cauliflower, broccoli, lentils, and Brussels sprouts. Tip number 8. Fiber. For some, it may help to add fiber, and for others, it may help to reduce fiber. Tip number 9. Other strategies. Give other strategies a try, including cognitive therapy and hypnosis. Such therapies have been shown to produce major improvements that can last for years. Tip number 10. Identify problem foods. Identify the foods which may intensify your symptoms and remove them from your diet. Tip number 11. Keep a symptom diary. Note down factors that bring on symptoms or make your condition worse. Tip number 12. Eat consistent small meals before large events. Before a big event, eat small meals throughout the day to avoid symptoms later. Often in a misguided attempt to prevent the onset of symptoms, IBS sufferers will avoid food before a big event. The problem with this strategy is that your body may overreact when food is finally introduced, especially if it is in a large quantity. Tip number 13. Peppermint oil may relieve symptoms. Peppermint oil, taken before meals, has been shown to relieve symptoms in the short term in IBS patients experiencing abdominal discomfort. It works by decreasing muscle spasms in the GI tract. Remember, it can cause severe heartburn, so take it in a capsule form. Tip number 14. Travel prepared. While traveling, be sure to divide your medications into 2 containers. Keep one in your hotel room and one with you at all times. Tip number 15. Yoga. Meditation and movement therapies such as yoga may help lessen symptoms of abdominal pain, bloating, flatulence, and diarrhea. Tip number 16. Avoid common food offenders. There are 4 common food offenders for IBS. These are caffeine, chocolate, fiber, and nuts. Thank you for watching. Please like, comment, and subscribe.